Hello and welcome to Medical Dialogues. I am Dr. Bhumika Makhuri. Let's look at today's top medical news. Managing 8 risk factors can help hypertensive patients live longer. Study. A new study led by researchers suggests that people with high blood pressure can significantly reduce and possibly eliminate their increased risk of premature death by controlling several key health risk factors at once. The findings are published in Precision Clinical Medicine. The study tracked more than 70,000 people with hypertension and over 224,000 without it, using data from the UK Biobank. Researchers followed participants for nearly 14 years to understand how managing these risk factors affected early mortality defined as dying before age 80. The 8 health risk factors evaluated in the study include blood pressure, body mass index, waist circumference, LDL, bad cholesterol, blood sugar, kidney function, smoking status, and physical activity. Notably, researchers found that hypertensive patients who had addressed at least 4 of these risk factors had no greater risk of an early death than those without high blood pressure. Hypertension, defined as a blood pressure of 130 mmHg or higher, is the leading preventable risk factor for premature death worldwide. The study found that addressing each additional risk factor was associated with a 13% lower risk of early death, 12% lower risk of early death due to cancer, and 21% lower risk of death due to cardiovascular disease, the leading cause of premature death globally. Can blood and urine reveal how much ultra-processed food you really eat? A new study published in the open-access journal PLOS Medicine has identified specific chemical signatures in blood and urine that reliably reflect how much ultra-processed food a person consumes. Conducted by Erica Loftfield and colleagues at the National Cancer Institute, USA, the research offers a new tool for objectively measuring ultra-processed food intake, which has been linked to various chronic diseases. The study analyzed biological samples from 718 older adults, alongside detailed self-reported dietary data. Researchers identified a wide range of metabolites, small molecules produced during digestion and metabolism, that were closely associated with the proportion of energy participants derived from ultra-processed foods. Using this data, the team developed a polymetabolite score, a chemical profile that serves as a biomarker for ultra-processed food consumption. This score could be calculated using a combination of 28 blood metabolites or 33 urine metabolites. The researchers found that these scores accurately reflected the participants' reported ultra-processed food intake levels. To validate their findings, the team conducted a tightly controlled feeding study at the NIH Clinical Center. 20 inpatients were provided with diets either rich in or free of ultra-processed food. The metabolite scores were able to clearly distinguish between high ultra-processed food and no ultra-processed food diets within the same individuals, demonstrating the reliability of these biomarkers in real-world dietary conditions. Worsening depression may predict future pain in older adults, UCL study finds. Middle-aged and older adults who experience frequent pain are more likely to have had worsening symptoms of depression and loneliness up to 8 years before the pain began, according to a new study published in Clinical Medicine by researchers at University College London. The findings suggest that early mental health support may help prevent or reduce physical pain later in life. The study analyzed 21 years of data from the English Longitudinal Study of Aging, which surveys a nationally representative group of adults over age 50 every 2 years. Researchers compared 3,668 adults who frequently experienced moderate to severe pain with an equal number of people who did not report significant pain. They found that in the pain group, symptoms of depression worsened sharply in the years leading up to the onset of pain, peaked when pain began, and remained high afterward. In contrast, the non-pain group had fewer and more stable depressive symptoms. A similar pattern was observed for loneliness, which increased before and after the onset of pain in the.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.